Hey, what's up guys? Don here, and today I'm going to be taking a look at how you can memorize a safe work procedure. Now, for this, I'm going to do a couple things. We're going to go over it. I'm going to pick a safe work procedure that I wouldn't be familiar with, so I'm going to choose something in an industry that I don't work in, and then I'm going to lay the groundwork of how you can do this using memory techniques and make it very easy and effective. So let's pick an industry. So I'm in construction and mining, and we also have a maintenance department, so I'm going to choose something that's not in those three. Choose an industry outside of construction, mining, and maintenance that would use safe work procedures. Healthcare workers. Okay, that makes a lot of sense. Okay. Let's go create a safe work procedure for a random task for a nurse. I'm going to make sure this is not too complicated for me, like something medical, but yeah, more. Okay, let's go with. Whoops. But easy to understand. I don't want to say a simple task, and I'm sure everything they do is not simple. Give it 10 steps. Oh, they threw 11 at us, but that's okay. Alright, so what we want to do is we want to think of a location that we know well. So this might be your home, your office. You want something that we know well, and we're going to need 11 locations. So I'm going to break it down, and let's get the help of DALL-E here. Create a typical living room. Create an image of a typical living room. And what we're going to do is we're going to take those ideas, those 11 ideas, transform them into an image, and we're going to place those ideas inside of this location, and then we walk through that in our minds. So let's just see what it comes up with. Wouldn't really say these are typical living rooms, but let's take a look. So I just want 5, so we could go with 1, 2, 3, 4, and then the carpet could be 5. We want it to make sense. It has to flow in a linear direction. 1, 2, 3, 4. And then the carpet is 5. So let's take a look at what we had here. Alright, so preparation, so gathering all their supplies. You could imagine just a nurse getting ready, gathering all her, like, whatever. Yeah, so they give it to you right here. Okay, so prescribed medication, IV line, alcohol swabs, gloves, etc. So it could be like their PPE from our industry, right? So their gloves, their alcohol swabs. So just imagine like grabbing a kit. So let's take that. So this is administrating medication via IV. Okay. Right. Image now of a nurse getting ready to set up an IV. This is the first step. So just to give you an idea of how this would work, so let's see what it comes up with for an image. Now obviously you're not going to stop creating an image with AI, but I just wanted to show you how it works. You will be creating this imagery in your own mind. So this works perfectly. So our first location, we would think of this woman here. She's getting ready. She's getting her tools ready. She's got her mask. And I'm just going to scroll up. And we're going to place that image right here on this chair. Okay, that image of that nurse. You're going to think of that right here. Okay. So that's preparation. Number 2, hand hygiene. So this will be pretty easy to think of. We go up here, and the second location we have is this window, so we could just imagine her washing her hands. Now, I like to make this pop a little bit. You want to have it maybe interact with the location. You have her wash her hands. Maybe some of the water hits the window, and it just sticks it to the location just a little bit better. Alright, so we have preparation and hand hygiene as our first 2 steps. Patient identification. Verify patient using at least 2 unique identifiers such as date of birth in accordance with hospital policy. So patient identification. So this is sort of when they go into triage and you tell them your date of birth, give them your health card. So this kind of works out good because our next location here, we could go with the couch. I would actually mix it up before I had the third location here, but because of what we're talking about, I'm going to put the third location as the couch. So I'm just going to see her sitting down with a patient, and I'm just imagining this interview. Maybe he's showing her his health card on the couch. So now we have preparation, hand hygiene, patient identification, 1, 2, 3. Next, I'll go with the lamp, and then we'll go down to the carpet. Alright, so explain the procedure. So I would actually just combine these 2 steps. So the first one, they're going over, he's showing her his health card, date of birth. Now I'm going to see her maybe show up a chart, show a graph of what's going on, maybe show an IV, explain, maybe a prescription. You could visualize something like that. Preparation of medication. Prepare the medication according to prescription instructions. Ensure correct dosage and dilution if necessary. So I'm going to get some help on this one just to kind of bring it to life a little bit better. So I would just basically kind of see her doing like a pharmaceutical type work here, almost like literally building a pill. But let's just see what they come up with for an image, just to make this pop a little bit better and easier to explain for me. Okay, now this makes a lot more sense. Okay, so the nurse is preparing the medication. Okay, so you could see either image sort of like this, right? And you're going to place that. You could go with the painting. You could go with the lamp. I like to keep it linear, so I'm going to go with the lamp in this situation, but that's up to you. Prepare the injection site. Okay, so I always pass out in blood work, so this is pretty easy. So basically, nurse is sitting down with them, swabbing the area, looking for a good vein, that sort of thing. And then you could kind of see that on the carpet. Maybe they pass out like me, and you want to just get them there immediately. So preparing the injection site. You can just see like the nurse is targeting the arm there. Now so we have our first 6 steps. Now do a kitchen that would go with the previous living room area. So I have to say I much prefer the kitchen over the living room. Just gonna take a closer look. Go. Like I said, I have to keep this linear, so maybe 1, 2, 3, 4, 5. So a little chair, this area, fridge, this area here with the bottles, and then the microwave. So injection technique. So put on gloves and use a septic technique. I don't know what this is, so I'm going to get them to show me a picture of that. I always pass out during blood work, so I don't think there's any worry if my employer is watching this of me going in to be a nurse that collects blood work. I don't understand what this aseptic means. Maybe I'll just ask, what does septic mean? Okay. So now I'm going to make this a little bit fancier. Make this pot during the memorization. So what I think of when I hear that they're trying to make this sure that this is free from pathogenic microorganisms, I see her like fighting off these bacteria and then using the proper technique. Perfect. This is exactly what I had in mind, right? So when we kind of make something a bit silly, we exaggerate it, it just sticks a little bit better. So now she's using the aseptic technique. She's preventing these microorganisms from entering the injection site, keeping everything nice and clean. So we're going to put that imagery right here. Administer medication, so slowly inject it. So now that one's pretty easy. So we'll see that in our next location, which is right here. So she's just slowly, precisely taking her time and injecting it into the right area. Secure the line, secure the IV line. So now we might get a little bit silly again. Remove the needle gently and apply. Secure the IV line to prevent accidental dislodgement. Okay, so I didn't quite like this one, but I did want to secure it. Nobody looks like this, but I do want to show, maybe I would have like her securing. She could be like handcuffing the, let me go over that again. Secure the IV line, so maybe she's like handcuffing the IV line. Remove it gently and secure it. Okay. So I just want to go over some of these again. So we had preparation. So this is where they were like gathering. We saw that first imagery there. Hand washing is pretty easy, and have like the water like hitting the window. The patient verifications, like where they show the health card, go over their date of birth. I guess it's sort of like a triage type situation. And then the nurse is kind of explaining what will happen. And then there's the preparation of the medication. I had to get a picture of this one, but basically the nurse is getting the medication ready for the patient, and then we have preparing the injection site. We have them like lay on the floor there, and she's kind of like looking for the correct vein, circular motion with the swab, the aseptic technique, which was my favorite so far, the injection technique, and she's there like fighting the bacteria off to ensure that the area is clean, away from any pathogens. Administer the medication nice and slow. Secure the line. Secure the IV line. So gently remove it and secure it. Dispose of the equipment so that we could see pretty easily, and then documentation, right? So we could see like this giant sharp container, right? You really want to make it pop. So this is where the secure goes. This is where the disposal goes. So she's just going to throw this out into a giant sharp container. They might do something different. Not a medical professional. And then we could just see her running documentation and filing it in the oven area. Oops. All right. So image 1. We have our preparation, right? So this is where she's getting all of her tools ready. Number 2, hand hygiene. So you could see, like I mentioned, you want to maybe have the water hit the window, have it interact with the location, right? Make it stick. Number 3, we have the patient sitting here. Then I'm imagining the nurse sitting here. So the patient is giving them their date of birth, health card, probably going over any vitals, that sort of thing, patient verification. So imagine like the triage type situation. And then the nurse is going to go over the procedure, explain how it's going to work. And then I see the nurse preparing medication on the lamp. All right, so getting that ready. And then they're going to go over the injection sites. This is sort of where they like swab the arm, look for a good vein. They might compare the left and right arm, see which vein's better. Okay, so that's our first location, first room, I should say. So this is using the proper technique, and they mentioned the aseptic technique, so this is where she's fighting off the bacteria. Make sure it is clean, slowly injecting it. All right, so she wants to administer that nice and slowly. And this is where they secure the IV line, so they're going to gently remove it, secure the IV. They're going to dispose it here, so imagine the giant sharp box, and then they're going to document it by filing it away in this oven. So no matter what industry you're in, using this sort of technique will help you do it, help you memorize what you need to memorize, and essentially what it's going to do is it's transforming our abstract ideas into something more concrete, and with review, you can memorize anything. Whatever it is you need to memorize, use this technique and it will work for you. Thank you and have a great night.